Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, January the 18th, 2021. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief, and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, good afternoon and thank you, Brad. Today is known in some quarters as Blue Monday, and while its origins are controversial, I believe that addressing the fact that this time of year can be challenging for some people's mental health is actually very important. It's worth acknowledging that last year that all the events that transpired this past year and the public health measures now in place meant, of course, to stop the spread of COVID-19 and to save lives have had an impact on the mental health of many, many people. Many people have never experienced the kind of stress and anxiety they might be facing now because of the unique circumstances in which we've found ourselves for some period of time. But as we have said from this table and tried to say it as a city administration from the outset, the extraordinary stresses it has created for people, and any other time for that matter, make it okay to say you're not okay. This is something that you've heard Chief Pegg say before, and that it is very, very important when you are feeling anxiety or stress that is beyond what you've experienced to reach out to someone and to share those thoughts with them. I know it's incredibly difficult for so many people to be so isolated right now, and that so many of the joys and supports that we count on and to some extent maybe even take for granted in everyday life are at present few and far between. So I want to reiterate the mental health supports we have available to residents of the City of Toronto through city services like 211, and to let people know that there are experienced people dedicated to helping you get through these tough times and make sure you get the support that you need, and that no one should have to hesitate to access these services and no one should have to go through this alone. It's worth repeating that we need much more mental health support, largely a part of the provincial healthcare system, and it is my hope that in the wake of the pandemic and all the lessons that we've learned from it, that one of the things that will happen is a renewed focus by all governments in investing in healthcare in all of its forms, but including in particular mental health and addictions, which have seen gross underinvestment for a very, very long time. We're working in many different ways to help the province roll out the COVID-19 vaccinations. The Chief will have an update on our immunization clinic, which opened today, and which will help Toronto and the entire province write the clinical operations playbook for all large city-run immunization clinics, which will be operating across Toronto and hopefully around the province and hopefully here as soon as possible, and of course once the vaccine is available. As anyone knows who may have been watching the NFL playoffs over the last few days, you need a good playbook. It is the only way to win. This immunization clinic playbook will be battle tested and will ensure in the coming months that we get the vaccines to people in large numbers when the supply is available, and to do it as well as we possibly can. Lessons will be learned, bugs will be worked out, so that as we move to literally vaccinate millions of people in just a few months' time and in a very short period of time, once we really get down to the large numbers, we will have the process required for such an unprecedented undertaking refined to the maximum possible extent. We are making progress now as part of an all-hands-on-deck effort to get the vaccine to our most vulnerable residents. On Friday, we completed the first round of vaccinations in all 87 long-term care homes in Toronto, a week ahead of the provincial deadline. This is amazing work done at wartime speed, as I call it, and it will make a difference in our fight against COVID-19. I want to thank all of those who helped make this possible, those at Toronto Public Health, at all of our city hospitals, our hospital partners, city staff, especially those city staff who work in our 10 city-owned and operated long-term care residences. And I want to pay tribute as well for all of these different things beyond Toronto Public Health to the work that is done by Chief Pegg and his immunization task force established some time ago to help with precisely these kinds of assignments. Also on Friday, we began vaccinating seniors in our homeless shelters. Unity Health Toronto ran a clinic to offer the COVID-19 Pfizer vaccine to more than 50 senior residents and more than 20 staff at the city-operated Scarborough Village Residence Shelter site. This clinic is part of a pilot to vaccinate people experiencing homelessness and staff at up to 4 shelter sites with support from the city's Shelter Support and Housing Administration, Toronto Public Health, and the Inner City Health Associates. This pilot, which operates under the province's vaccine framework, is prioritizing shelter sites with the highest population of seniors and people with a significant risk of a severe outcome were they to come down with COVID-19. All of these characteristics put these individuals in question at elevated risk, including their residence in a congregate setting, so their vaccination protects their health and helps to reduce the chance of outbreaks. The purpose of this pilot as well, similar to the convention center, is to produce a playbook for clinic operations or shelter operations at clinics of this kind so that people, when they proceed to do vaccinations in all shelters, for that matter across the province, have, again, had all of those experiences and processes and procedures battle tested. Also last Friday, University Health Network, UHN, ran a one-day clinic to vaccinate frontline workers at the city's COVID-19 recovery program for people experiencing homelessness. Up to 200 workers at this isolation site were offered their first dose of the Moderna COVID-19 vaccine. This site was selected as a priority site for the vaccine due to the direct role staff have in caring for vulnerable people affected by COVID-19 and through its connection to the University Health Network. As you may recall, both the Inner City Health Associates and UHN helped the city to establish this site, the first isolation kind of its kind in all of Canada last spring. The city is grateful to our partners who are running these vaccine clinics to help protect our most vulnerable residents and the frontline workers who care for them. Finally, I would like to say that on our command call this morning, a call that we have every morning to oversee the management of the pandemic, I raised the issue of mandatory masks in common areas of apartment buildings and condos. The city was one of the first municipalities in Ontario to move forward with mandatory mask rules in businesses, on transit, and in shared spaces in private residential buildings. I've asked the staff to drill down into the complaints we have received about masks and face coverings not being worn in apartments and condos. And that is so that we can identify, for example, any really frequent addresses that come up where we have more than an average number of complaints, and to follow up with building owners who are responsible for putting these policies in place in each of their respective buildings. The bylaw, recommended by the Medical Officer of Health and our city legal staff, requires building owners or operators to have a policy to ensure masks or face coverings are worn by individuals in the enclosed common spaces, such as the lobbies, the elevators, and the laundry rooms, and to post corresponding signage. We even created signage at the City Hall for buildings to use and to post, and it is posted itself, the signage, on the city's website, so it's easy for people to reproduce it, and many have done so. It is my hope that this review by city staff of where the complaints are coming from will ensure that this bylaw is continuing to be followed by building owners and individual residents, and I think the two go together here if we want this to be successful, particularly during the ongoing lockdown. I will look forward to reporting back on the results of that as time goes on. I would now like to ask Dr. de Villa to give her report for today.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 892 new cases of COVID-19. 491 people are in hospital. 113 are in the ICU. And I regret to tell you that there are 2 more deaths to report. There are 50 active outbreaks in long-term care homes and 12 in retirement homes. This is important because we now know that the delivery schedule for the Pfizer vaccine has been slowed by the need to retool Pfizer's principal vaccine production facility. But as the Mayor just said, fortunately, the first round of vaccinations have been delivered in Toronto at all 87 long-term care homes. Across Ontario, the province has decided the best course of action for now is to reallocate the available supply of vaccine to ensure that it is provided to long-term care homes and high-risk retirement homes, and to deliver second doses to those who've received their first dose of vaccine. In my view, as a physician, this is a sensible strategy for the allocation of available vaccine, given the circumstances. But on a personal level, I can understand how people feel about news like this. Everyone wants their turn. So as your doctor, I would say this to you. Stay patient and stay optimistic. There is good reason for both. While we want the flow of vaccine to be swift, uninterrupted, and high volume, the fact of the matter is that this is the first time a vaccination campaign on this scale has ever been designed and implemented, and the whole world needs their share of vaccines. Public health has years of experience in the delivery of mass vaccination programs. And from experience, I can tell you that even with the best plans, there are bumps along the road. We should all prepare ourselves, mentally and emotionally, for those bumps. But bumps will not alter the determination to get those vaccinations in arms. My understanding is that the deliveries of Pfizer vaccine are expected to catch up through February and through March. Additionally, Health Canada is reviewing data on the AstraZeneca Oxford and the Johnson & Johnson vaccines, and the federal health minister said recently that a decision on the AstraZeneca Oxford vaccine is in the near future. So please, be patient, be optimistic, and let me add, be determined. While the vaccines arrive and vaccines are delivered, we've still got to protect ourselves from COVID-19 because it is still circulating and will continue to circulate. But with those efforts, what will happen is that the case counts will decline. In Toronto, we're already seeing signs of how we ourselves are truly the best defense against spread of the virus. Anecdotally, over the weekend, when I was out walking, I saw that the significant majority of people on the streets were masked. This said to me that people were taking control and making decisions to protect themselves and reduce spread, and I was delighted to see it. Additionally, as you know, Toronto Public Health is able to analyze non-identifying cell phone data. One measure we look at is data that reflects how much time people are spending at home. Time at home measures were high last March and then decreased over the summer during reopening. We saw modest increases in time at home following additional measures put in place in October and November. Interestingly, the most recent data for January 3rd through to the 9th shows time at home at 82%. In March of last year, it was 87%. This suggests that the lockdown from December 26th has had some impact on movement in Toronto. It is early going though, but if it holds, then over time, decreases in case counts and hospitalizations should begin to emerge. It can happen if we are determined to stay at home and apart from people we don't live with for the short term. Imagine a city not so many months from now where we are all vaccinated, but where COVID is at low levels while we get there. We can get there. So let's. With that, I'll hand it over to Chief Pegg to deliver his remarks for today.
Thank you, Dr. de Villa, and good afternoon. Today is an important day in our continuing fight against COVID-19. Earlier this morning, our first non-hospital operated COVID-19 immunization clinic began operations inside the Metro Toronto Convention Centre as part of a proof of concept exercise. A sample group of healthcare workers has been receiving vaccines this morning. As a reminder, at this point, this clinic is open by appointment only and is not able to accept walk-in clients nor those who do not have a confirmed appointment. The City of Toronto was asked by the Province of Ontario to accelerate the launch of this first clinic in order to test and validate all aspects of the clinic operations plan. As part of the proof of concept work, our teams are validating the registration lists and schedules that have been assembled for this initial clinic. Yesterday afternoon, we understood that there were potential issues with respect to the initial registration process for this clinic, including some registering who may not fall into the prioritization framework. We are in the process of reviewing these issues in order to ensure that we implement any necessary changes moving forward. Should we determine that there are in fact people registered who do not qualify for vaccine at this time, we will contact those people directly, and we will remind everyone that the proof of concept clinic's initial clientele are frontline healthcare workers working in the city shelter system and in public health. These proof of concept operations provide us with an important and valuable opportunity to ensure that all aspects of clinic operations are ready for wide-scale deployment when vaccine becomes widely available. As Mayor Tory explained, an important outcome of this work will be the creation of a clinic operations playbook that will ensure that we are ready to open a wider network of clinics across Toronto once vaccine supply allows. This completed playbook will be provided to our provincial partners for their use as well. At present, this clinic is operating on the basis of administering 250 vaccinations per day, while we operate in proof of concept mode. This is only 10% of the planned clinic capacity of more than 2,500 doses per day, which we expect to deliver once the clinic is operating normally. We are initially operating this clinic at this scaled back capacity in direct response to available vaccine. The procurement and supply of COVID-19 vaccine is the responsibility of the federal government, who then distributes vaccine provincially. The Province of Ontario then allocates vaccines for local administration based on available vaccine supply and in accordance with their prioritized vaccine distribution framework. We were all disappointed to learn that the delivery of Pfizer vaccine to Canada is expected to be delayed as a result of manufacturing delays in Europe. As a result, we have now been advised by the province that we will only be able to operate this proof of concept clinic for an initial 5 days due to the lack of availability of COVID-19 vaccine. Accordingly, we are required to pause clinic operations at the Metro Toronto Convention Centre site at the end of day on Friday, January 22nd. Anyone who successfully scheduled an appointment to receive their first dose in the Metro Toronto Convention Centre clinic beyond this Friday will be advised directly. But those with appointments on January 23rd or after should plan on their appointments being cancelled until further notice. There will be no impacts to second dose availability, and we will ensure that everyone who receives their first dose before the pause of operations also receives their second dose within the permitted timeframes. Of course, we look forward to resuming clinic operations as very soon as we are able to do so, as advised by our provincial partners. We are continuing to explore all options to accelerate our ability to administer vaccines to Toronto residents once larger quantities of vaccine are available. This will include planning for extended hours of clinic operations, expanded clinic capacity targets, and implementing innovative delivery methods that meet the needs of our city, including mobile vaccine clinics, priority neighborhood response, hospital-led clinic operations, and widespread public access via pharmacies and primary care physicians. Everything we have done in responding to COVID-19 in Toronto has been fully scalable, from the design and operation of the COVID-19 incident management system to the operation of this and every other vaccination clinic that we are planning for. This clinic, as with all the clinics we will operate, has been specifically designed and operated to protect all aspects of infection, prevention, and control, commonly known as IPAC. Finally, the enforcement of public health-related regulations has been a priority for the City of Toronto since the outset of COVID-19. Our coordinated enforcement teams have been working diligently to enforce the regulations related to COVID-19. The City has taken formal enforcement actions 1,965 times to date. As a result of violations of the Reopening Ontario Act, 10 charges were laid and 12 notices were issued against owners and operators of retail stores, linen and houseware stores, beauty supply and nail salons, and a hookah lounge. Enforcement staff also conducted 146 proactive inspections this weekend of restaurants and bars with no tickets being issued. Additionally, 41 charges were laid as a result of large gatherings on private property. This included a gaming house and gatherings in private residences. Toronto Police also responded to a number of protests, resulting in 20 charges being laid under the Emergency Management and Civil Protection Act and 4 charges being laid under the Criminal Code. Thank you for your continued support and patience as we all do our very best to put COVID-19 behind us. Please continue to monitor toronto.ca/COVID-19 for the most accurate and up-to-date information in our city. Thank you.
Thank you, Chief. Before we go to questions, just a reminder to reporters to please unmute yourselves. If you're using a phone, you can do that via *66. Also, any questions related to enforcement, Inspector Matt Moyer from the Toronto Police Service is on the line, as well as Carlton Grant from Municipal Licensing and Standards. Our first question is to Ashley Legasic from News Talk 1010. Go ahead, Ashley.
Hi, thank you so much for taking my question. Dr. de Villa, you just explained how encouraging it is to see the time at home data increase for the first week of January. Do you think sharing encouraging data like that more often will help show people that their actions are making a difference and that life doesn't have to be like this forever? And Mayor Tory, I'd love your input on this as well.
Well, I think I certainly hope so. We would like to encourage people and show that they can make a difference. And in fact, we know that they can do this because we've had this experience in the spring. We saw when people stayed home that we were effectively able to reduce the spread of COVID-19 in the city. We understand, how the virus spreads and how social interaction actually facilitates that. So to the extent that people are able to heed the advice, practice those self-protection measures that we've talked about so often, watching distance, wearing your mask, washing your hands, staying home when you're sick, the more people are able to do this, the more we will be able to reduce the spread of the virus. And as vaccines become available over time, we have that extra tool this time around relative to the spring. So I am hopeful about that and hopeful that people appreciate that it does make a difference.
I really think this kind of information is going to help us to encourage people to continue to do the right thing. I hadn't thought of the ability we have because we've been disclosing this data on a kind of a top-level basis, but I've now asked as well that the people who supply it break it down by day of the week, hour of the day, part of the city, so that we can see kind of where people are doing a really great job. And similarly, I've asked for traffic data, which in all of these bits of information come a little bit late because they have to sort of collect it and then find a way to present it to us. But the traffic data I'll get about once a week, and we'll share it publicly. But what it showed in the spring, for example, was we got down to about half in that range of the normal traffic levels, and then it rose back up to about 85%. In the sort of late summer, fall period, and had dropped down only to about 70% by the end of the year at the sort of Christmas period. So I think, what we hopefully will see is as January unfolds further and the stay-at-home order took hold, that traffic levels will further drop. And it's not ironclad indication of whether people are doing what they've been asked to do, and in some cases required to do, but it certainly is some indication of compliance, and I hope we can use it as a positive encouragement for people to keep up the good work so it'll get us through this dark tunnel that we're in and out to the other end where the vaccinations are available to millions of people.
Thank you. And I don't want to get too ahead of myself, but I do think it is important to have things on the horizon that we can count on and look forward to. So if we stay on the right track and get a lot of shots into arms, bring cases way down for spring and summer, is the city working on plans in order to give a boost to the local economy, local businesses? What can business owners look forward to later this year?
I can respond to that simply by saying yes. We had some plans that were ready to stimulate people's attendance and patronizing of restaurants. We had sort of shop local campaigns, events that were going to happen in the different neighborhood main streets, but a lot of them were put on hold because obviously when we entered into a period of further public health restrictions in the fall, it made no sense to be running those kinds of campaigns. And we were doing them through the BIAs, through Destination Toronto, which is the tourism development agency, and the city with business. We're all working together on that. And I can only tell you that a lot of those things, the plans are actually ready. They can be modified for the fact that 6 or 8 months have passed, but the answer is yes, there will be initiatives undertaken to help get the city back on its feet, to help infuse that spirit of can-do into the city. And all we can do is both keep our fingers crossed, but more importantly, follow public health advice in the meantime to stay home, wash hands, wear masks, and all the things we're familiar with, as well as getting the vaccination program well executed. And I think then that will be the time to look at some of these kinds of programs.
Okay, thank you. We'll go next to Mark McAllister from City TV. Mark?
Thank you. I hope you can hear me okay.
We can, yes, go ahead.
Dr. de Villa, if you could further the information on the time at home data that you've received from mobile devices. You said we've reached 82% compared to the 87% in March. Did you have a particular goal in mind? Do you want to get to that 87% or higher?
So, Mark, really what we're trying to do is to get to the level where we're effectively staying at home and seeing the results of that reflected in COVID-19 case rates. So, you know, to the extent that we're able to get people to stay at home where they can, we know that not everybody can work remotely. It's not a possibility for all of us, but to the extent that we're able to facilitate the ability for people to stay at home and only go out for those most essential of needs, the grocery shopping, the pharmacy, healthcare, and exercise, then we know that we'll have less interaction between people and reduced COVID-19 rates as a result, while vaccine comes on board and helps us in our toolkit against this disease.
And to both Mayor Tory and Dr. de Villa, Premier Ford once again addressed a question about paid sick days today, and more or less said the federal system's not working and there's no need for the province to step in at this point. Just wondering if you could give us a response.
I would respectfully disagree with that conclusion, although I did have a very constructive conversation with the Premier about this matter yesterday. I think it is likely going to require some provincial intervention to make sure that people are guaranteed to have these sick days without fear of losing their paycheck. But I think at the same time, and I think the big city mayors and chairs that met today agreed with this, that it probably will involve the federal government as well on the financial end of this. And we're talking about during the pandemic to make sure that people who are tested positive or who are awaiting test results don't lose their paycheck. So one of the ideas, for example, floated by the big city mayors and chairs that met today was the notion you would have the province say that this is a compulsory matter for employers to provide these days to people who are in need of isolation during the pandemic and during that period, and that the employers would be required to pay the people, but then the federal government, through its unemployment benefit emergency system, would repay the employer. So that way you don't get into the whole business of filling out paperwork and so on. You just say to people, yes, you have the time that you need to isolate during the pandemic. Yes, you will get that benefit from your employers, and the federal government will then reimburse those employers. But I think something like that may in fact involve both governments is going to be the answer. And the real challenge for them now is for somebody to step forward and say, here's a regime that we together can implement with employers, with the federal government, with the provincial government to just make it happen. It's time for it to happen. We've been discussing this. I can't even count how many times I've sat here on behalf of and on my behalf, on behalf of the other mayors as well, and said this is an urgent issue that is causing people to go to work sick. It's not right, and we should fix it.
Apologies, there's no need for Dr. de Villa to answer that question if she doesn't want to. Thank you.
Well, Mark, I think that the only thing that I would say is that, look, I'm not an expert in determining, in whose jurisdiction different actions should fall, provincial, federal, et cetera. But from a public health perspective and from what we actually hear on the ground, working with community partners who have direct connection with workers, essential workers who are affected by the current state of policy and the current lack of supports. They are still having to make very, very difficult choices, actually untenable choices, between sustaining their families and trying to protect their own health and the health of those around them. And it seems to me that there is a solution. We know from a public health perspective that creating supports, creating an environment that actually supports workers to stay home when they should, without fear of loss of income or an inability to support their families, is just good public health. So I would leave it to other levels of government to make determinations around how best that gets implemented and who funds it. But from a public health perspective, it's just good public health.
And Brad, I'm sorry, if I could just clarify my earlier answer, I don't really care. As the Mayor of Toronto and speaking on behalf of these people that can't often speak for themselves and need some help, it doesn't really matter which government resolves it. And so when I say I respectfully disagree with the Premier, I only mean that to say it's one government or the other is not necessarily the case. If any government, any one government of two that are available to do it, could say we mandate this to happen during the pandemic for all employers, that the employees are going to be, receive their paycheck or an equivalent or something close to their paycheck during the period of the isolation they're forced to endure, and thirdly, that there's a way worked out to handle all the sort of the mechanics of that, and if that can all be done by one government, fine with me. Then they can agree with each other on which government does it. But what we've got right now is what I've described before as this ping-pong game that goes on where nobody seems to really just say, fine, I accept the responsibility, or I have to do it with the other government. It's just nobody's doing it now, and that's not a satisfactory situation.
Well, thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. To Chief Pegg, just on the Pfizer delays affecting the vaccination clinic, I believe this was supposed to go from 6 to 8 weeks originally. Now that you're down to 1, the fact that you are being tasked with making this entire playbook for the province, I'm just wondering how much of a disadvantage you see this putting those operations at, especially when this program is designed to be scalable. Will you be able to effectively have that data on hand now with only 1 week of data?
Yeah, thanks, Matt. We're certainly going to do our very best. And the fact that we learned today that we are going to have to pause only after the first week is very disappointing to all of us, and I'm sure very disappointing to all of our city. That being said, we are learning every minute, and we'll continue to learn every minute of every day that we're operating the clinic. As I described or discussed in my remarks, we have a number of very comprehensive and very robust quality assurance processes that are underway, and all of that work will ultimately inform the creation of the playbook. So certainly the drafting or the preparation of the playbook will not need to pause. We will continue with that work. We will continue to assess and evaluate and learn from the experiences that we will gain over the first 5 days, and then we'll have to reach a decision in collaboration with our provincial partners as to whether we pause that playbook pending the restart of the clinic and I would say a period of additional assessment, or whether collectively between myself and our team and our colleagues and our provincial colleagues, whether or not we feel that we have sufficient quality assurance in place to produce a playbook. So somewhat of a work in progress, somewhat of a decision that needs to be made in collaboration with General Hillier's team, and we'll take that in due course.
Thank you. And just to follow up again on vaccinations, you were talking to the Board of Health this morning about some of the equity challenges that are in place. And I'm just wondering on the past experience when it comes to testing related to racialized and lower socioeconomic groups that we've already seen throughout the pandemic. How big of a challenge do you think it is once vaccines do become more available? How much of a challenge do you foresee ahead of you to reach all of those people? And just when it comes to the mobile vaccination buses or units that you were talking about, are you going to be reusing the buses that you used for testing that were repurposed?
So Matt, why don't I start off and we'll see whether the chief has anything further to add. Certainly we are going to use the lessons learned from the testing endeavors that we have done in conjunction with community partners. And with respect to the challenges of reaching all the corners of the city and reaching all the different subpopulations throughout this very big city, we have every intention of relying on our community partners. We recognize that that the best way to engage with the various communities all around the city is to leverage our relationships with other providers who are closer to the populations, closer to the ground, and really have very established relationships of trust with the various people and communities throughout the city. So that was one of the key lessons that we learned thus far in the pandemic, and we feel an obligation to really continue to deploy those lessons and really benefit from those lessons and use them in the future. So we're hoping that that they will inform us, but we anticipate as well that testing is one thing, vaccine is a little different, and I expect that there will continue to be lessons learned as we undertake this rather large immunization endeavor, largest ever in the country. We will be open to learning. I think the chief talked about the immunization clinic that's happening at the Metro Toronto Convention Centre, talked about learning every minute of every day. That'll be no different for any of the other immunization efforts that'll be undertaken in the city.
Okay, thank you very much. We'll go next to Nick Poivert from CBC News. Nick?
Hi, thanks. And for Chief Pegg, you mentioned today at the Board of Health meeting that the city would be ready to open up a lot of the other vaccination clinics if the supply is there. So given the delay that we've seen today and maybe some other challenges that could come down the road, can you give us an idea of like an actual timeline? What can you tell the residents about when the city could actually open those if you're prepared to do it earlier?
So the initial target that was provided to us by the province was to be in a position to begin to open our immunization clinic network on around April 1st. So that initial target has not changed. As we talked about, the province made the request of the city to accelerate the opening of the initial clinic, which is, as we discussed, now operating at Metro Toronto Convention Centre by a significant period of time. That's more than 8 weeks. So that clinic is operating. So our initial target is April 1st. I will say that in response to and in light of the information that's come to us from our provincial colleagues with respect to the forecasted availability of vaccines, that may well cause us to need to adjust and shift, if you will, some of the planning for the additional clinic network. But that, I would say, that decision has not been finalized yet. We have additional meetings upcoming later this week with General Hillier and with the Provincial Vaccine Delivery Task Force that will inform those decisions. So as we've said from the start, we know that the Government of Canada procures the vaccine. We rely on the Province of Ontario to deliver it. So therefore, we take their wise counsel and their best assessment as to when we ought to plan to open our clinics. Our commitment to the City of Toronto is that we will be ready. Our goal has been, although it's a daunting task to prepare a network like that, a fairly simple objective in that our goal is to be ready early and to be ready with very short lead time in order to turn on, if you will, additional clinics and additional methodologies. And I have every confidence we will. Our planning will continue. And like I said, we'll wait until we get some additional information from the province who has that line of sight on vaccine availability with respect to how that impacts the schedule.
And on another topic for Dr. de Villa, is Toronto Public Health aware of any instances yet where the UK variant of the virus is suspected or confirmed at an LTC home in Toronto? And do you think anything needs to be done to make sure that the variant doesn't breach LTC facilities and can be contained if that happens?
So I'm sorry, Nick, was the question whether there is any incidence of the variants in long-term care?
If you're aware of any yet in the city, and what you want to see done to make sure that if it does get in, that it won't spread as easily as it seems like it can.
So in the city, yes, and with respect to trying to limit its spread, so the current understanding based on the available data and evidence is that there are certain variants that are circulating. They are circulating and have been found in many places throughout the world. And the understanding is that they are more transmissible than some of the earlier variants that we were seeing here in Toronto and in Ontario writ large. What should we be doing? Interestingly, it is the same advice for now for each of us as individuals to really stay at home as much as possible. While we do have some understanding that these variants of COVID or SARS-CoV-2, to be more appropriate in terms of the virus, while we have some sense that they are more transmissible, at the end of the day, distance, distance, and distance is still the best defense that we have right now until such time as we're able to add vaccine more broadly as part of our toolkit. So again, I would just remind people from an individual perspective, the best thing that we can all do is to stay at home as much as possible, where that is possible, and only go out for those most essential of activities, the groceries, the pharmacies, healthcare, and getting that exercise so as to maintain as best as possible good mental health and good physical health as well.
Okay, thank you. We'll go next to Francine Copen from the Toronto Star. Francine, go ahead, please.
Good afternoon, everyone. My first question is for Dr. de Villa. Regarding the mobility data, I just need a clarification on the, when you talk about 82 or 87%, what does that refer to? Does that refer to the percentage of mobility users that are staying home? And also, do you think that closing schools has made a difference in the mobility data?
So when it comes to the mobility data and we're talking about the percentages, that refers to the amount of time or the proportion of time that those devices are at home, at the home location. Hence, it's a proxy for how much mobility there is amongst people in the city. With respect to how much schools are contributing to that, I don't know that I can be very definitive about that. Certainly, I'm sure it plays a role. How big a role, how significant? I don't know that we'll be able to tell until after the fact when we really have an opportunity to reflect on the data that we have in greater detail. But certainly what we are seeing right now, premised on what is available to us and what we were able to analyze, we are seeing some promising signs that people are staying at home, which is a good thing. That's exactly what we're hoping to see in terms of our collective ability to reduce the spread of COVID-19 in our city.
Can I just add to that, Francine, that one of the reasons that I wanted to see us slice and dice that data a lot more, and also the traffic data, there was a suggestion, for example, that the traffic data was down more in the morning, and when I asked the people who help us collect and analyze this data why that might be, it was suggested that it's right around the time when people ordinarily would be taking kids to school. And so this is the kind of thing we're going to try to find out, both with a view to sort of seeing what's happening and what isn't happening in terms of good behavior, as it were, but also trying to just analyze, areas where we can improve and things that we could pay more attention to in terms of our own communication to people. So I think when we have a further chance to analyze both the phone data and also the traffic data, it will help us to learn some lessons about different parts of the city, different hours of the day, and that kind of thing.
My second question is for Chief Pegg. Siobhan Morris from CTV pointed out that York Region opened a COVID-19 vaccination hub in early January, and they were vaccinating 1,000 people a day, which raises the question, is Toronto being ambitious enough when it comes to getting vaccination clinics up, or is it proceeding too slowly relative to other places?
I can assure you that we are being very aggressive in our planning and in all aspects of the development of our immunization clinic network, if you will. As we discussed earlier, the reason that we have opened the initial clinic with a flow through, if you will, of 250 vaccinations per day is solely because that is the amount of vaccine that can be properly provided, or can be, sorry, I'm struggling for the word, can be confirmed to be provided for us from the province of Ontario to support those clinic operations. So like we've talked about, we are downstream from the delivery or from the supply of vaccine. We are dependent on the province for that. The province felt confident that they could supply 250 doses a day initially, hence that's why we've opened at that. As I said, our clinic, the clinic model at the Metro Toronto Convention Centre, our planned capacity is more than 2,500 doses a day, that ultimately, once that clinic opens in normal operations, we will operate at or above that level. So I am very confident that we are planning appropriately. We are being, I believe, sufficiently aggressive, if that's the right term, but also balancing that against a quality assurance process and against being able to provide assurances, obviously to our command team here in the city, to each of our residents, and to our provincial partners, that we can in fact meet the commitments that we're making, and I have every confidence that we will.
Let me just add, Francine, I believe that clinic in York Region is also a hospital-led clinic. This clinic at the Convention Centre is the first non-hospital-led clinic for the proof of concept. We'll go next to Justin Hayward from CBC News. Justin?
Hi, thank you for taking my call. I'm not sure who's best placed to answer this, but Dr. de Villa was speaking a little earlier about the slowdown in delivery of the Pfizer vaccine. It's a temporary slowdown, we know, but it seems like there's not enough to go around at the moment. And at the same time, you guys are talking about your pilot project to vaccinate people who are dealing with homelessness. So obviously, some people will say, why are we using part of the limited supply on the homeless population? And I'm just wondering what you would say to people who would ask that.
So why don't I start off, addressing the question. So first and foremost, the pilot projects that have been undertaken at the behest of our provincial counterparts. Whether we're talking about the immunization clinic at the Metro Toronto Convention Centre, or the shelter pilot that has been undertaken under the lead of Unity Health Toronto. We're certainly supporting that. These have been undertaken at the request of the ministry, and it is to understand and to learn in small opportunities, what it takes to run this kind of vaccine undertaking, in different scenarios with different operators and that kind of thing. I think the other thing that's really important here is that these are all in keeping with the prioritization framework. And when it comes to the shelter pilot in particular, it is a shelter that houses those who are an older population. In fact, my understanding is that it is perhaps one of the oldest, populations in terms of shelter populations in the city. So it is akin to that which we are seeing in long-term care homes or retirement homes, and therefore a high-risk population and a group of healthcare providers and frontline providers who actually take care of their needs. So again, not that dissimilar from what we see within long-term care homes and retirement homes. But for now, there are some restrictions, and as I mentioned in my remarks, the province is appropriately focusing its efforts on ensuring that throughout the province, long-term care homes and high-risk retirement home populations are getting what available doses there are, and of course, that those who received first doses are getting their second doses so that they actually complete their course of vaccination. This, I think, is a very reasonable course of action given the current supply challenges. But ultimately, what we all hope for is a resolution to those supply challenges so that we can roll out vaccine to as many people as possible. Of course, looking at priority populations first while supply is an issue, but when supply is no longer an issue, really hopeful to have more vaccine to provide to all those who are interested in getting vaccinated.
So going forward, once the supply is a little less tight, will there be a certain amount earmarked to vaccinate people who are dealing with homelessness?
Well, I should hope that there would be a certain amount, that there would be vaccine available to everybody. But yes, there would be a special need and special regard, I would imagine, to those who support people living in congregate settings, particularly older people living in congregate settings where we know the risk of transmission is high and the vulnerability of the population to negative outcomes associated with COVID-19 is also high.
Okay, thank you. We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead, please.
Hi there. Thanks, everybody. My first question is to, I guess, Dr. de Villa or anybody who wants is, we've been talking about slowdown of the vaccine supply kind of in terms of data collection and also kind of overall population morale. But this is a difficult question, but I'll ask it. Is the slowdown going to result in more illnesses and more deaths of Torontonians? Because you're saying we'll catch up in the ensuing months, but there are surging numbers right now. And will we have more people get ill and more people die because of the slowdown in the vaccine supply?
Well, I will say this, and you've heard me say this before. There is much control that we have in our own hands. We know that distance makes a huge difference in respect of transmission of this virus. So to the extent that we actually all focus, for those of us who have the luxury of working at home, for those of us who are able to do this, right, to really focus down on limiting our interactions outside the house to the greatest extent possible, there's much that we can control in terms of reducing COVID-19 spread. So if we limit our interactions outside of the home, really only go outside for the most essential of activities, whether it's groceries or attending to healthcare or managing some physical exercise, getting outside to get some physical activity, good for mental health and good for physical health. To the extent that we're able to limit our interactions with others, we actually have a lot of power in our hands in terms of controlling the spread of COVID-19 and reducing, the possibility of infection, illness, and subsequent deaths. Of course, we all want vaccine supply to be restored and to be much more free-flowing and much more available. There's no question about that. But in the meantime, we do know that this strategy, self-protection measures, and the vigilant use of self-protection measures actually does work.
Thank you. And my follow-up question is about enforcement. We saw a video on the weekend of some of the marches, and I understand there were some people ticketed, but we also saw what looked like sort of a police escort of the people going through the street. And I don't know if you saw, there was a video where a vehicle stopped, and I think it was a pastor from outside of Toronto kind of came, sort of put himself out, and people were coming up and hugging him, and there were officers standing by. I'm wondering if there's somebody from the enforcement side that can talk about that, because there are people watching that who say, why don't you just break it up? Like, how it looks like you're enabling a process that is inherently breaking the law.
Yeah, thank you, Dave. I'll ask Inspector Matt Moyer from the Toronto Police Service to respond. Inspector Moyer, I think if you're on a phone, you'll need to do star 66 to unmute yourself, please. There we go. Go ahead.
Can you hear me okay?
Yes, sir. Please go ahead.
So I guess if I understand the question, we're talking about the whole concept of sort of the social distancing that may or may not have been present for the police officers during the protests or demos on the weekend. Is that accurate, or?
Yeah, just the idea of seeing officers walk along, and if you just see a video, it almost looks like they're protecting the people or enabling the protest to happen.
Okay, I understand the optics of that, and it's a very fair question. Thank you for that. I think the challenge, though, is for this weekend is that the direction involved a couple of pieces. Obviously, we recognize that it's not only a public safety issue, but it's a public health issue, first and foremost. So there's obviously going to be a big piece of this is going to be the communication that we have with people, and it steps up to a caution. And what you might have seen when you're looking at it might have been conversations that were taking place because we think that's an important part. However, this weekend, I think we sent a very clear message that enough is enough, and that an enforcement piece had to be also put into place, because the same people are showing up at these events. And clearly what we need to do is send a message that when you put the city during a pandemic at risk by continuing to not wear masks, not social distance, not wear any form of PPE, that there has to be an enforcement piece that goes along with it. I think the day of our having those conversations has sort of come to an end, and we need to use the enforcement under the ROA. I understand that you're going to see officers standing close together, because we actually had a lot of officers down there, and that's going to be the message going forward, that we need to look after the city in such a manner, and that's going to be represented in our enforcement contribution.
Mr. Mayor?
May I just add to that, and I know that, David, you weren't implying otherwise, but may I just say, I've had the unique vantage point of being able to watch these demonstrations every Saturday, because they come by my home as part of their route, and that's a question for another day. But I watch the police, and the police are, of course, trying to protect the people who are in the march. They are trying to protect everybody else and keep everybody safe, because they're going down a street. And I just have watched them perform with extreme patience, and I'm actually gratified personally as mayor at the fact that they have issued some tickets, and that enough is enough, because I believe that and have for some time. But I just want to say I think they're doing an excellent job keeping everybody safe, which is something they have to do all the time, no matter what the views are, or even the law says with regard to the protest itself, and keeping people safe and acting in a very balanced way. And I commend them for that, because I've had a chance to see it for several weeks now, and I think that's exactly what they're trying to do.
Thank you very much. We'll go next to Sean Lethong from CTV News. Sean, go ahead, please.
Hi there. This question's for Mayor Tory. Thanks for taking my call. We're following up on the safety blitz that the Ministry of Labor did this weekend at big box stores. And they found that there was a compliance rate of about 70% with COVID-19 infractions. I know, Mayor Tory, you'd expressed desire to see only essentials sold at box stores. Also, one of your councillors, Councillor Bradford, had sent a letter to the Premier today saying it's time to only go to essentials. Do you join that call, saying that it is now time to only sell essentials at big box stores?
Well, I've said this for weeks now, maybe even months, that I think the big box stores should be limited to the grocery section, and I think that essentially covers the essentials. But they've chosen not to go in that direction, but I'm very heartened by the fact they had what seems to be quite a pervasive blitz on this weekend. And I think that when you get to a 70% compliance rate, that is something that would get you a B, I guess, if you were in school. But I think we're looking for an A+. And so I hope that the steps that are taken, both with warnings and sanctions, and also the encouragement I heard the minister giving them, Minister of Labor provincially, will cause a higher level of compliance unlike in the event that the stores remain open, which seems to be the case at the moment, as much as I think it would be helpful from the standpoint of crowding and interaction of people and all the rest for them to be more closed.
But you don't think it's necessarily time to go that extra step, given that they haven't, like you said, they've only gotten a B?
Well, I think, again, that's the kind of question we address around here by talking to our medical officer of health, by looking at what's going on. And if you see, steadily improving levels of compliance to the point where you get to an A+, then it could be the case that, we're able to achieve what we're all trying to achieve, which is this reduced interaction of people, distance being kept between people, no crowd scenes at lineups outside of any kind of stores, no crowd scenes inside stores, people wearing masks inside stores and preferably outside. And I think if you achieve all that, we've often said here that it's going to be personal behavior that will determine that more so than what the rules are that are in place. I personally think they should have been closed except for the groceries for a long time. But that's my view. I don't make those decisions. And I guess if we think that that's going to make a big help to driving those numbers down, then I guess we'll say so at that time. When I say we, we'll be doing it based on the expert medical advice and what's going to be needed at a given point in time to really make things much, much better.
Thank you. Final question is to Miranda Anthistle from Global News. Go ahead, Miranda. I see you're unmuted, Miranda, but we can't hear you. Can you try one more time, Miranda? I'm sorry, we're not able to hear you. If you'd like to,
I have Miranda's questions and I can ask them for
thank.
her. If
All
that's
right,
okay.
Matt. Colleague of the
behalf of
day.
my
Go ahead.
colleague.
Go ahead, Matt. Thank you.
Perfect. Sorry, that Miranda's question that she handed me was in regards to enforcement. Building managers were telling her that they're exhausted trying to enforce mask wearing policies inside, and some are even getting aggressive pushback and saying that they are feeling helpless. If they can't find people and there's no provision for the city to charge individuals inside condos, people who are not following the bylaw, how can really all this be expected to work? And is there anything the city can do to help them out?
Or maybe Carlton Grant or the Chief Pegg replies to that. I will just say this. I think the reason why we're going to take a look at the data based on the complaints we've received, and there's a couple of thousand of complaints in total spread across the entire city, is to see if they're concentrated in certain places. And then it allows you to follow up in those places with those building managers, and because again, it is the owners of the buildings that have the responsibility to see, what circumstances they find themselves in, why they haven't made a greater effort to, how much signage they put up, why they haven't made a greater effort to enforce or to try and get compliance. And so I think, it'll be after we look at the data of where the complaints have come from that we'll be in a better position to answer that question and to see what more that we can do. Knowing from the beginning, I think we said this from the beginning, it's virtually impossible in a city, I think, that has 3,500 apartment buildings to have a bylaw inspector or a police officer or anybody else in every one of those buildings all the time, tracking down every tenant who might choose not to wear a mask, some of whom might have a medical exemption. So we're going to have a look at the data and see what it says, where the complaints are coming from, and then see what action, seems to be suggested by that. And maybe Mr. Grant would like to comment.
Carlton Grant, our Executive Director of Municipal Licensing and Standards, if he has anything to add. Carlton?
I think the mayor has hit it right on. We have to look at the data and see where this is happening, and then we will work with those problematic properties if that's what they are. Again, over 3,500 apartment buildings. That doesn't include the condominiums. So it's a large swath of complaints. I think we have 1,950 since the summer. So we'll take a look at those, and if there are frequent flyers, we will visit those buildings. We will work with those property owners and property managers. And I think it's also maybe prudent to spend some time in those buildings, in those lobbies, and educating the residents of those buildings of their, really their responsibility that all of us are doing in not staying home and wearing a mask.
Thank you, Carlton. Matt, did you have a follow-up for your colleague?
Oh, sorry, Miranda just had this one follow-up. Why is the city giving out tickets to people not abiding by the public health guidelines at anti-mask rallies, but not giving tickets to people who violate the mandatory mask-wearing bylaw inside common areas in condos and apartment buildings?
Maybe Mr. Grant again will want to comment, but I want to, in defense of the people who are out doing this job, if you think about it, one of the reasons we're going to analyze the couple of thousand complaints we've had about this is to see if there's 4 places where we've had 200 complaints each, in which case maybe that makes it easier for us to go and do that. But if you think of the challenge involved in trying to keep up with 3,500 apartment buildings plus all the condo buildings, I don't know the number of condo towers, but it's hundreds, I'm sure, if not thousands. It's just not practical to, it's not an apples to apples comparison. But we're going to look at the data. We're going to see, as Mr. Grant said, if there are problematic places, in which case then you go and have a look at why that might be the case. Do they have signage up? Is there nobody in the lobby? There's 1,000 reasons that could be the case, and take it from there. So we're on this, and we'll see whether there's an answer that lends itself to, to the world of practicality in terms of the enforceability of all of these kinds of things. Mr. Grant may want to add to that.
Carlton, do you have anything to add to that?
Yeah, just that communications, and that's why, again, the city and myself, we do a lot of media. I think it's really prudent to get that message out there through the media and through this press conference and through your channels to articulate to the residents of these apartment buildings that they should wear a mask, and get out the message to the property owners and the property managers as well, that they need to have a policy, that they need to have signage, and they need to take this as seriously as we all are.
Carlton, thank you very much, and thank you all for joining us. That concludes today's briefing. Our next briefing will be this Thursday, January the 21st at 2 p.m. Stay well, everybody. Thank you.